There is a hope, even when your brain tells you there isn't. Very well said quote by the John Green. Good evening, everyone. I am Khesty student of Bareilly College, Bareilly, first rank BCom honors. I will be presenting my view of point on the topic public health. The reason why I chose this topic to speak on is the unavailability of proper healthcare in my village and to spread the information on this topic. Before I start the presentation, I would like to thank the Delhi University and GSTS for providing a platform for the students to express their view of point and ideas. I would also like to thank the guest of honor, Mr. Ashwani Kumar sir, for their precious time. Let's begin. Before talking about public health, let's understand what the health according to the WHO, which stands for World Health Organization, me- means. Means what health means. A state of complete physical, mental and social well-being and not mainly the absence of disease is known as health. Now, after knowing what health is, now understands the meaning of public health. Let's see what public health has to say. The science and art of preventing disease, prolonging life, and promoting health through the organized and collective efforts of society and organization. Let's talk about Uttar Pradesh, as I belong to Uttar Pradesh. Uttar Pradesh, Uttar Pradesh has three-tier health public health care system: primary, secondary, and tertiary care. Primary care is delivered through sub-health centers and primary health centers. Secondary and tertiary health is provided through community health centers, subdivisional hospitals, dis- district hospitals, and medical colleges. The state has a significant numbers of healthcare facilities, including 25,723 SHS, 3,055 rural and 598 urban PHS, 939 rural and 11 urban CHS, to 125 district hospitals and 49 medical colleges. The state also has a large number of private medical colleges and hospitals. Now let's talk about Bareilly. Health infrastructure of Bareilly has private hospitals and public hospitals, polyclinics and specific centers like mental health, polyclinic like ECSS provided for ex-servicemen, private hospitals as we have IE hospitals, etc., public hospitals as we have different government schedules. And now let's talk about public health policies in India. India's public health policies are etiquetted the National Health Policies, also known as NHP, aimed to achieve universal health coverage and improve access, affordability, and quality of healthcare service. What are the key goals and objectives of the public health policies in India? First, universal health coverage. Second, to provide access and quality of best healthcare services, addressing health disputes. Both type of policies are there in our country, public and private. When I say public, there are Ayushman Bharat, which provide Ayushman card to the people who are unable to get their treatment done. In private, we have health insurance and Medicaid. When I mention health insurance, you can subscribe or take premium of any health insurance, which you can claim at the time of your surgery or at the time of anyone once in the year to get your whole body checkup done. Now let's study the history of health policies in India. British rule. When the British were ruling in India, health policies were primarily focused on protecting the British population and military personnel with limited attention to the health of Indian population. Focus of health policies was on protecting British civilization and army attainments from diseases with a secondary focus on sanitation and, diseases control. Public health service for the native population were completely neglected, leading to a high mortality rate. After the British left India, India's health policy framework evolved significantly, moving from more colonial approach to a more comprehensive and integrated system. The communities, which were formed in 1946, report laid the groundwork, and the 1983 National Health Policy (NHP) marked a key milestone. Now, as we had mentioned earlier that after British left our country, the evaluation has done. Now let's take a look at the evaluation of health sectors. The healthcare sector has evaluated significantly, shifting from ancient practice to the modern technology-driven approach. This evaluation comprises advancement in medical knowledge, treatment methods, and public health innovations, ultimately leading to the improved health outcomes. Now, let's get back to the early healthcare practices, which involves practicing like herbal medicines, rituals, and basic hygiene. After that, we got introduced to the Ayurveda. Ancient Indian system like Ayurveda focused on holistic health where treatments based on balancing body energy. For example, whenever you eat more junk food or more oily or spicy food, your pit get increased, which indicates that you will get more aggressive, you will get more irritated easily. So in Ayurveda, the Indian system was to balance your body energy to make your health more better. Hospital development. Now came the hospital development in our country. Over the time, hospitals and medical education emerged, laying the foundation for organized healthcare. When we are talking about the hospital development, then we must also talk about the All India Institute of Medical Science, which is also known as AIIMS, the dream of every neat aspirant. AIIMS was established in 1956 as an autonomous institute of national importance through the Act of Parliament. The object of AIIMS is to provide the best education to make the perfect and specialized doctors in the future, to provide the best faculty, to provide the education at the minimum fees. According to the current fee structure, AIIMS only charges 5,000 rupees for the course of 4.5 years with the facilities of mess food, hostel, etc. Now came the rise of modern medicine. Germ theory. Germ theory of disease developed in the late 19th century, working around the understanding of disease which was caused by them. Now came the vaccination. As we all know that the germ theory was moving around the diseases, how that was caused, the causes of diseases. Now the vaccination came into the play. The development of vaccine led to significant programs in preventing and treatment of the different diseases. Now 20 and 21st century technology innovations. Now in 2021st century we have technology which helps medical fields very much to to indicate cancer at the very early stage. You can get your MRIs done, you can get your CT scans done to look into your brain, look more deeply into your brain and to analyze what the actual problem is. Then came the organ transplant. The best example of organ transplant would be the transplant of an hand which was done into a man's body. But the twist is the hand was of a female body. The surgeon did an excellent job that he fixed a female's hands into a male's hand, and now currently that hands are working properly and fully functional. Then came specialized medicine. To emergency of specialized medicine fields such as chronology, oncology, etc. Now, as we all know, diseases are of two types, communicable disease and non-communicable disease. Now, I will talk on the topic communicable disease. History of communicable disease. The history of communicable disease is a long and marked by significant outcomes that has shaped human history and social structure from an ancient time to the modern pandemics such as COVID-19. Example of communicable disease can be TB, malaria, HIV, AIDS. There are so many programs run by the government which are IDSP. Now let's talk about the history of non-communicable diseases. Non-communicable diseases have a complex history, evolving from being longly disease of developed nation to be global health crisis, particularly impacting developing countries. For example, heart disease, stroke, cancer, which are very common in today's youth. As we are talking on the topic disease, as we all know, to cure any disease, we need medicine. And some medicines are highly expensive, which a middle class family or family under the poverty cannot afford it. Now, generic medicines come into the play. Generic medicine is a medicine that is developed to be the same as a medicine that has already been authorized, which the medicine which is already authorized can be purchased as a lower rate, which is being named as generic medicine. Now let us take a look of the advantages which we can get from the role of genetic medicine. First, it is affordable we cannot as we cannot as we cannot as we cannot buy the highly priced medicine, we can afford the generic medicine. For example, metformin, which is used by the people who have diabetes, which in their body they cannot control the sugar levels, so they can use this medicine. It is bioequivalent to the brand name drugs and it is accessible also. Now now I can compare the policy in India and in the China. Health policies in India, decentralized and state level. In India, the policies are decentralized and different states have their different schemes. Focus on universal health coverage, national health policies and Ayushman Bharat. Ayushman Bharat is a scheme introduced introduced by by the government for the people who cannot afford the expensive treatments. Public health policy in China, centralized and government-led, emphasizes on prevention of the disease before it can become a pandemic. Zero COVID policy, new cooperative medicine scheme. These were the policies introduced in China. Now, when we are talking about the public health policies, then very important topic should be talked, which is child mortality. Child mortality refers to the death of children under the age of 5. It is so pitiful that the child who was just born, who haven't even seen the world fully, is not able to survive till the age of 5. The possible causes could be infectious disease, birth complication, malnutrition, and unsafe environment. In what areas we are not able to get the malnutrition? We can take the perfect example of the slum areas in Delhi, Bihar. There are many children under the age of 5 who suffers from malnutrition, infectious disease. Now, the infectious disease has been done due to uncleanliness in their areas. The uncleanliness water, undrinkable water, which is supplied to that area, unsafe environment is also a key point which led to the child immortality. The areas which are not safe cannot be drinkable waters is not available in the unsafe environment. Clean air is not is done. Right now, I come to the conclusion of my speech, which led to me that my suggestion to the government or my takeaway from my presentation is that the government should invest more in non-organizational foundations. It should conduct more seminars in the schools, in colleges, which could lead in the spread of information about the public health, led by the professors to the people who are unaware of the uh, policies, schemes which are run by the government. Thank you.
Thank you so much, Khesty. That was really a wonderful talk. And सबसे पहली बात आप काफी young scholar हो. You are still in your graduation, under graduation, I should say. And from being an economics student, या फिर I should say आपका role ज़्यादातर it's not really in public health sector. You have not studied about the sector in academia, but still the way you've presented your research, the way it perfectly shows that it is definitely your research interest, and we are very sure कि आप definitely इस field में काफी ज़्यादा prosper कर सकती हैं if you keep continuing with this. So and your talk was also very commendable because आपने history की बात करी, आपने इंडिया में generic medicines about AIIMS, the development of AIIMS, and how AIIMS has and generic medicines have proven to be the pillars of strength for the Indians who struggle with their economic status. So आपने एक ऐसे सेक्टर को चूज किया, एक ऐसे एस्पेक्ट को चूज किया है which is very relatable, which is very mass appealing, and we would congratulate you for that. And we would also encourage you कि आप इस area में अपनी research continue करें, and you know grow better with this academic interest of yours. So with that being said, अब हम चलेंगे अपने question and answer round में. We have a few questions that have been posted on the chat box. The first question is by Mr. Shubham Tiwari, and he is asking, what are the policy implications of growing burden of non-communicable diseases in India? तो आपका क्या take है इस पे?
I was not able to hear the full question. Can you please repeat the question?
Sure, I will. The question is, what are the policy implications of the growing burden of non-communicable diseases in India?
When the non-communicable diseases are more likely to happen in the early 20s nowadays, uh, due to our eating habits, due to our routine which the youth is following nowadays, even government, if government brings out a policy for the non-communicable disease, it won't be much effective because as a youth, we are not putting the efforts into our lifestyle. Now, when I say lifestyle, we can compare the lifestyle of a youth in nowadays versus the routine of a youngster in the 90s or in late 90s. They were waking up early at 4 o'clock. They were not eating any madas like we eat momos, burgers. They don't eat such kind of things. They were eating fully nutritious meal made at their homes. Nowadays, the youth is eating more kind of a junk. If I say in a very straightforward tone, junk means momos. You can go from burgers, pizzas, which does not even have the proper nutrition which a youth needs. So I believe if a person wants to, avoid any non-communicable disease, just look into your routine. It will be more beneficial for the person rather than looking for any non-communicable scheme which government has to come up with.
All right, Kesdi. Well, इसको हम ऐसे भी समझ सकते हैं that government के initiatives for non-communicable diseases is it's also dependent on the factor कि the individuals also take care of themselves. Okay, it's the two are not
Yes.
mutually exclusive categories; they are interdependent. So we as responsible citizens also should make sure that we don't fall into that category where we are not aligning with a healthy lifestyle and then expect any external measures to cure us. Okay, so we have another questions by Shailendra, and he is asking what strategies are in place to tackle urban and rural disparities in healthcare services. So urban or areas may all the disparities, the differences. So how are they being tackled by the government? So.
Now, when I speak about rulers, people who are in rural areas, they have Ayushman cards, which came under the scheme Ayushman Bharat. They can register themselves in that scheme and get their treatment done in any hospital all across the India if that hospital accept that card. They can get their treatment done. They can get 50 to 60,000 cut down from their expenses. And when I say in urban areas, people have the opportunity for going into AIIMS, like they can travel from cities like Kolkata, Delhi. They have inbuilt AIIMS hospitals, which are government hospitals, and in that hospital, the treatment is done at a very low cost for the people. So I think the government has done these two things to tackle the parties in the rural and the urban areas.
All right, and it's also important to see that अभी मैंने कुछ time पहले ही I came across this data which said कि it was like a few months back, and it mentioned कि almost 42% of the health services that are being offered in India. So this study was by Indian Public Health Standards (IPHS), and it said कि 42%, which was almost 17,000 plus facilities जो है हमारी country की, they scored below 50%, which also talked about the deficiencies. And this 50% ke below ka jo score hai, this is not just a part of rural India. So it was all the facilities in the rural and the urban areas. So definitely there are disparities, and they should be taken forward together, because the difference and the lack is pretty evident. It's pretty substantial, which is 42%, which is a very big number. All right, we have one more question by Miss Manvi, and she's asking, what are the major challenges in implementing health policies in rural India?
According to me, the biggest challenge is that people don't have the information, or they are unaware of the schemes which government launches. Due to the lack of knowledge, many people are unable to apply for that scheme. So the biggest challenge for the government is to make sure that every person or every people in that city state can get or knows about that scheme, so that if that person is in a needy situation, they can apply for that. So that, I think, that is the biggest challenge. And the second most important challenge, what I think, is that people are not coming up. Some people who are in rural areas, they are unaware of certain schemes which led the failures of certain policies which were made in the favor of public, but due to lack of information, the policies were not being able to run in a long term.
All right, Khesty, well answered. I'll take up a few more questions because we have sufficient time. Another question is, how is the success of a public health policy evaluated? So, आपको क्या लगता है कौन से ऐसे factors हैं या aspects हैं that are used to measure or evaluate the public health policy?
So, any policy which is successful till now has been successful with the collective efforts of public and government. To work out any policy, the public and government have to work together. Government provides you the information, they provide you the money, they provide you the fund. But people are the one who have to use it to avail the full benefit of that. You know, any any policy which government introduce is just like a cycle. The two wheels are, the first one is government, the second one is public. So both have to work together to make sure that the policy which government has, the government has put forward can succeed. So that is my view of point in that question.
Definitely, most definitely. And it's also important to consider that there are definitely steps that are being taken by the government. And also, it's very important and significant to realize that the budget allocation for, the health sector for this year was, it saw an increase of 9.878% as compared to the last year. So definitely the government is trying its best to safeguard all its citizens and provide a good health set up for all the Indians, and it's also up to us how well and how responsibly we avail those facilities that are being facilitated to us. So we have one more question by Dr. Rakesh Kumar Rajak sir, and he's asking a very interesting question. He is asking, does national health policy include yoga in its goals? So what is your take on that?
National health policy, according to me, or according to the knowledge which I have, yoga does not come into the health policy because yoga is a total different aspect as when we compare that to the health policies, because yoga is a, you can say, as a exercise, you can take it as a sport, because yoga within itself, yoga has a very wider range. Like in yoga you can do meditation, you can do asanas, you can do different kind of things. But when we talk about national health policy, so in that we are more looking into, more development of hospitals, infuse of technology with the hospitals. So yoga and national health policy, I don't think so. They go together very well. And yoga in itself, yoga is not made for everyone. Like I, being a district level player of yoga, I can definitely say that everybody cannot do yoga like any other person, right? And everybody's body is not made for yoga. You can do meditation, you can do little bit of Surya Namaskar, but not everybody can do Chakrasan, Shirshasan, different kind of things. So national health policy is a very different aspect as compared to the yoga.
All right, Casey, that was a good take on it. But I would also like to add on कि there is a bit correction that I would like to offer you. कि if अगर yoga directly involved नहीं है, but it's also not exactly excluded from the national health policies that India has, provided for the citizens. The scheme of Ayush is in itself, it stands for Ayurveda, Yoga, Naturopathy, Unani, Siddha, and Homeopathy, which is realizing the Indian roots and the Indian knowledge system, which can offer very beneficial, health practices for the citizens. But definitely, considering your research area, your question and answer round has been very amazing so far. And I'll take one last question by Mr. Shailendra again, and it's also a very interesting and an important question because misinformation ke around centered hai. So how do you think, what strategies can we implement, or what strategies can we use to combat this misinformation in public health? How do we fight against misinformation?
Um, the very basic rule, I think, which everybody knows, that whenever you get any information, just go to the original website and look at them. As simple as that. You don't have to go to any news channel, no website, nothing. If World Health Organization is coming up with a research, coming up with a scheme, their website, original OG website is present. You can go there, we can search and we can read the research. If government is putting out some scheme which they are working on, the correct information will be on the website. As we take the example of Ayushman Bharat has its own website where they update any new information if they have to put forward. So for any, I believe that as being a responsible citizen, as being a responsible, uh, people taking the advantage of the policies which we are getting from the government, I think we should always rely on the original websites rather than any message coming from Facebook, Twitter, or from WhatsApp. So I believe you should just follow the original website. That's it.
Very well answered, Kesty. And so that concludes that we should verify the information. We should be media literate. The media literacy is missing in many Indians. So we just blindly follow whatever comes in front of our screens. So there is a need for expert engagement, for monitoring and tracking, and a very big need for the social media regulation to combat all these misinformation that occur in this domain of public health. So that was a very interesting and engaging Q&A session with you, Khesty. And again, I would like to congratulate you for being so confident and so fluent with your Q&A session in such a young age when you are in your just in the middle of your undergraduation. So we would again like to congratulate you for that. And again, one last question, but that is a question which we asked to all of our speakers. And the question is, what was your experience with the GSTS and how was it working with the team?
So, for starting with, this is the very first time where when I am talking in an online presentation. I do take part in debates in national seminars, but this was the very first time where I was taking part in a very big platform and putting my point of view. So it was a very amazing, very eye-opening journey for me. Like from last 2 days, I was having meeting with Manish sir and then Shubham sir, etc. Many professors and ma'ams were there. They were
How many
guiding me.
meetings? How many meetings?
So approximately three. I took the last meeting today at 1 o'clock, from 1 o'clock to 1:30, which was the final pre-meeting before this session. I believe that every opportunity should be grabbed by everyone because you might not succeed or you might not win that path, but every every opportunity gives you some lessons. And the best lesson which I have learned from this platform is how to be more accurate on the topics or the ideas or the vision which we have in our heads, how to present our thoughts in a very proper way so that it is in a very valuable as well as in a very presentable manner. So, in the end, I would like to thank Dr. Manish sir for their precious time they have put behind me, and Ajay sir, Mansi ma'am, all the facility they were working with me from last 2 days. They were putting so much efforts to make sure my presentation was on point. So thank you so much to everyone for their precious time.
Um, Thank you so much, Khesty. It was really a wonderful experience to have a young mind and an enthusiastic scholar like you in our platform. And we would love to, hear from you again with a more refined, more detailed version of this talk again in the future. And we would also like you to stay connected with our platform. And yes, so congratulations for your talk again. Uh, with that, I would now again like to invite our most honorable chief guest for the session, Mr. Ashwini, sir. So, sir, we would like to hear your comments, your insights and suggestions, and further directions for Kesti's talk, and also a few words for the platform. So, sir, over to you.
Thank you, Smriti. Uh, Khesty, first of all, congratulations. And actually, it was so insightful. We learned a lot. And particularly when you say that you are here to learn so many things, actually, that is true. Everyone learns so many things. We have learned so many things from you also. Detail PPT, बहुत अच्छी presentation, well thought process, question answer. और इस age में जैसे स्मृति ने कहा, this age it is really difficult to articulate so many things and answer difficult questions. It is really difficult, and congratulations on that front, particularly considering your age. And I know that it's a long way to learn so many things in this process, and you are eager to learn. That is the most important thing for a scholar, at least those who are learning things. Khesty, maybe हम कुछ थोड़ा थोड़ा इसमें कुछ ऐड करते हैं, and it is important since everyone here is to learn so many things. Since you are from commerce background, we must include some of the data here. If you try to include, for example, maybe if you try to include some data related to health expenditure as a percentage of GDP, and you can compare this health expenditure with other countries also. Maybe in primary, how many units are there in primary sector, in secondary, in tertiary units? Because primary, I think we can claim that it is almost a foolproof system here in primary health sector. Almost in every village or every second village, you will find the primary health center type of things, and the government hospitals will be there. In secondary and tertiary sectors, we need to improve a lot, particularly because it requires a lot of money to install infrastructure. And then we know one thing, that when a person or a family, particularly those who are in need of these facilities, and if they want to get these facilities, then from middle income group, they can become low income group after a disease or a critical disease. They have to spend a lot of money, and it can stress their finances. So that secondary and tertiary sector is important. Particularly, what will be the role of the government here? When we say policymakers and we think about policymakers, then what should be the role of the policymakers, particularly government? First of all, why should government intervene in the health sector? The one thing is that's what you suggested in your PPT also. It should be affordable, it should be available, and it should be available, at least first of all, because we have a lot of population, more than 1 crore, 140 crore people here in India. So availability is the first thing. Then it should be affordable, everyone should afford it. Equitable distribution, that means everyone will get, irrespective of their income level. Some of the facilities are available for poor, some of the facilities are not available at middle and upper middle class, so they can afford, they can buy it from the market. So it is true. But still, why should government intervene in the system? There are 2-3 cases. One is because there are so much of positive externalities. For example, if I give you an example, and if you consider 3 cases, particularly when we say the traditional public health system, one thing. When we say traditional public health system, that mostly private sector never prefer to operate in these areas, particularly maybe sanitation, maybe clean water, maybe immunization. It requires a lot of money, and these are we call public goods. It is available for everyone. Everyone will be benefited, but no one is ready to get funds for these things. So government need to put in money. Government need to take initiative in these areas and start all these things, because everyone will be benefited. So immunization, maybe clean water, maybe sanitation. If I give you one example, Swachh Bharat Mission, and WHO says that we have saved around 3 lakh death from diarrhea. So this Swachh Bharat Abhiyan, one thing, remember one thing, when we say that poor sanitation actually leads to frequent, infections. So when we try to reduce the infection, these are preventive measures. So clean water, proper sanitation, Swachh Bharat, even making toilets are becoming so important in India. And when you are creating so much of toilet, more than 90 million toilets were made by Indian government. They helped to provide subsidies, and nudge was also important, nudging was also important. That's what you said, that sometimes public is not aware about the things, and information gap is there. So you need to come up with some advertisement or some information, particularly with Amitabh Bachchan type of thing. Then when you say that darwaja band to bimari band, so जब अमिताभ बच्चन आएंगे तो फिर लोग सुनेंगे ना उसको, तो वो इंफॉर्मेशन गैप कौन फिल करेगा? वो इंफॉर्मेशन गैप गवर्नमेंट फिल करेगी. दिस इंफॉर्मेशन, प्रोवाइडिंग इंफॉर्मेशन इज आल्सो a public good, because private sector do not take any interest by providing all these facilities unless they are involved in these sectors. Second, even in Swachh Bharat Abhiyan, 93% female feel that they are safe now. And this safety is so important in rural India. 93%, they are safer, they are better. 50,000 per family, it is saving, because less infection is there, so we need to spend less money, and therefore that is the saving for the families. It's a big advantage for economy, at least. And I say that government should intervene, and that is the one example where Swachh Bharat Abhiyan, and we usually call it soon, it's not so much significant to make toilets in India, but actually it is important. These are preventive measures. We call it a traditional, public health system type of things. And usually every time, even from ancient to nowadays, everyone, every king, every government should provide all these facilities, and they have been providing, and this government is also providing. So second thing, when I moved to primary health services, most of the government have been providing all these things, and for last 70 years we are improving in the primary health center. So in primary health center, I think rather than quantity, we need to concentrate more on quality now. सो एब्सेंटिज्म है, जो आपने बोला, गांव में हेल्थ सेंटर नहीं है तो डॉक्टर नहीं आता है, डॉक्टर आता है तो फिर वो टाइम नहीं देता है पेशेंट को, गवर्नमेंट जो मतलब फिर वो काम नहीं करना, वो बहुत सारी फीलिंग ऐसी अगर आती है जहां पर कमिटमेंट नहीं है डॉक्टर की. सो ऐसे बहुत सारे फैक्टर्स हैं जहां पर we need to intervene, government need to intervene to provide quality services rather than quantity. We have provided quantity, but now we need to move beyond that one. So quality services should be ensured. Third thing, I think, in the secondary services, secondary facilities where hospitalization is required for critical diseases, maybe kuch bhi aap, even secondary or tertiary ko if you club together, secondary tertiary, where hospitalization will be required, some critical diseases will be there, maybe cancer hai, maybe diabetes hai, lifestyle disease, and you need to spend a lot of money. And when you put a lot of money, and most of the people cannot afford to go for better hospitals, then government need to provide these better hospitals. So government infrastructure, government hospitals हर city में हो. जैसे अभी government ने बोला कि अभी recently जो budget में बोला कि every city must have one cancer hospital at least, every district must have one cancer hospital. और अभी ये जो disease जिस तरह से बढ़ रही हैं, ये facilities government provide करे. Suppose government cannot provide all these facilities to all the population, then what should we do? Then government should tie up with private sector by providing insurance facilities. And that's what Ayushman Bharat scheme is doing. So when we say Ayushman Bharat scheme provides 5 lakh rupee benefit to every family, and this premium is paid by governments, central and state government, because health is a state subject and every state will make their own policies. But obviously center need to coordinate between all these policies, between different state policies. So in this situation, when we say Ayushman Bharat scheme, we do not pay anything, those who are actually getting benefit. So they do not need to pay anything for that premium also. They are getting benefit equal to 5 lakh rupee. अब 5 लाख रुपए ना आप सोचिए कि एक फैमिली के लिए, जो लो इनकम ग्रुप फैमिली है या इवन मिडिल इनकम ग्रुप फैमिली है, उसके लिए बहुत इंपॉर्टेंट है. वो एटलीस्ट ऐसा नहीं होगा कि वो उसके बाद वो लोन में मूव कर जाएगा, या उसको लोन लेना पड़ेगा, या उसको जमीन बेचनी पड़ेगी, या उसको कोई एसेट सेल करनी पड़ेगी. क्योंकि जो बीमारी है जिसको हम कहते हैं इकोनॉमिक्स में इनइलास्टिक डिमांड है, यू हैव टू पे मनी, यू कैन नॉट गो फॉर बार्गेनिंग एंड no, I can't afford it. So you have to sell something to get rid of all these diseases. लेकिन उसको avoid कर सकती है. So government should be there to protect all these vulnerable population. And when we say make it affordable, make it equitable, and that's what we say, that government should be there, either through government hospitals, government facilities. And suppose we cannot provide because there are limited funds with the government, then we must tie up with private sector with insurance facilities, and this insurance facility can provide the benefit to everyone. अभी रिसेंटली गवर्नमेंट ने एक और इनिशिएटिव लिया है कि 70 ईयर्स से ऊपर वाले जितने भी हैं एज है, और उसमें बहुत इंपॉर्टेंट है, बिकॉज अगेन इंश्योरेंस नेवर प्रेफर टू गिव बेनिफिट टू दीज पीपल. उनके लिए कॉस्ट बहुत ज्यादा हो जाती है. सो इंश्योरेंस सेक्टर उसको नहीं एक्सेप्ट करेगा. प्राइवेट सेक्टर बहुत कॉस्टली है, एंड ओल्ड एज पॉपुलेशन और ग्रोइंग पॉपुलेशन है आपकी. आप जानते हैं कि इकोनॉमी इज गेटिंग ओल्डर ग्रेजुअली, सो इसलिए ओल्डर एज का पॉपुलेशन शेयर इंक्रीज होगा. सो इसलिए वो रिक्वायरमेंट, सो गवर्नमेंट इज प्रिपेयरिंग फॉर दैट वन. ओवर एंड अबव 70, everyone will get the benefit of Ayushman Bharat irrespective of income level, and that is the most important thing. Up to 5 lakh rupee. आप किसी भी प्राइवेट हॉस्पिटल में जाएं, इवन आपकी सर्जरी है तो सर्जरी से 3 दिन पहले और सर्जरी के 15 डेज के बाद भी जो भी आपके एक्सपेंडिचर हैं, एक्सपेंसेस हैं, वो गवर्नमेंट कवर करती है। सो इसलिए ये सारे जो एक्सपेंसेस हैं, ये सब जो एडवांटेज हैं, बहुत इंपॉर्टेंट है। सो दो बातें जो मैं कहना चाह रहा हूँ, एक, why should government intervene? Because government intervention will make it affordable, will make it available at quality level, at least qualitative affordability, qualitative availability, that is the most important thing. And government should intervene either by providing direct infrastructure or facilities, or by motivating private sector to invest in these areas. Second, again I'm saying healthy person will be an asset for any economy. अगर health benefit है, आप बीमार कम पड़ते हैं, फैमिली में एक्सपेंडिचर बहुत कम होते हैं, आप जॉब पर बार बार जा सकते हैं, बार बार आपको छुट्टी लेने की जरूरत नहीं पड़ेगी। अगर आप लो इनकम में नोटिस करेंगे तो बहुत बड़ी प्रॉब्लम होती है, एक वीक में 3 दिन बीमार हो गए और फिर जॉब पर नहीं जा पा रहे हैं, तो बहुत सारे इश्यूज आते हैं। सो हेल्दी इंडिया बहुत इंपॉर्टेंट है फॉर विकसित भारत। दिस हेल्दी and educated India is the most important thing, and that's why I feel that particularly in these two areas, education and health, it should be affordable, it should be available to everyone. And this healthy India and educated India will make Viksit Bharat. That is, I think, the most important thing. आपने बहुत सारे एरियाज को कवर किया है केस्टी, और मुझे लगता है कि हम सब अप्रिशिएट करेंगे इस एज में वो नॉलेज एक्वायर करना, वो कंटेंट कलेक्ट करना, अप्रिशिएट करेंगे कि एटलीस्ट ये करेज शो करना कि मैं जा करके अपने जो आइडियाज है उनको कम्युनिकेट करूं। इसके लिए बहुत करेज चाहिए इस एज में एटलीस्ट। और एटलीस्ट जो हमारी सोसाइटी है उनको मैं बहुत ज्यादा कॉन्ग्रेचुलेशन मेरी तरफ से, क्योंकि ये जो इनिशिएटिव है, मुझे लगता है कि ऐसे बहुत सारे बच्चे होंगे जो जिनको लगता होगा कि मैं भी कनेक्ट होना चाहता हूँ, मैं भी अपनी बातें कहना चाहता हूँ, उसके अंदर भी बहुत सारी चीजें हैं जो वो कम्युनिकेट करना चाहता है। वो प्लेटफॉर्म जो ये अवेलेबल करवाते हैं और उससे हम सब लर्न करते हैं एक दूसरे से। तो जो इन्फॉर्मेशन जो आपने बोला मिस इन्फॉर्मेशन की प्रॉब्लम है, प्राइवेट सेक्टर भी, जो मनीष सर ने इनिशिएटिव लिया है कि ये जो मिस इन्फॉर्मेशन है, अगर हम सब अपने अपने एरिया में इंफॉर्मेशन स्प्रेड करना स्टार्ट करें तो हम बहुत सारी चीजें एक दूसरे से लर्न करते हैं। और इसलिए मनीष सर आपको तो बिग थैंक्स एक्चुअली, और थैंक्स सिर्फ इसलिए नहीं कि आपने मुझे इनवाइट किया, एक्चुअली थैंक्स इसलिए कि ये जो इनिशिएटिव है ये एक्सीलेंट है, और यूथ को कनेक्ट करना, यूथ को कंस्ट्रक्टिव एनर्जी के लेवल पर कनेक्ट करना, ये बहुत इंपॉर्टेंट है। और इस एज में जब बच्चा अगर कंस्ट्रक्टिव होगा, अगर वो राइट डायरेक्शन में होगा, तो मुझे लगता है कि कोई भी बच्चा जो राइट डायरेक्शन में होता है वो ऑब्वियसली कंट्री के लिए एसेट होता है। सो थैंक यू सो मच मुझे इनवाइट करने के लिए। कुछ अगर आपको कुछ और है, कोई क्वेश्चन या कुछ और है, तो हम डिस्कस कर सकते हैं। थैंक यू सो मच सर, थैंक यू।